بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. محاضرتنا اليوم بعنوان Absorption of a drug. هي تكملة للprinciple of drug therapy. As you remember in the last lecture we talking about pharmacokinetic, and the first process we are talking about it which is absorption of drug. Absorption of drugs, as you see, absorption is the transfers of a drug from site of administration to the bloodstream. Actually, the rate and extent of absorption depend on the environment where the drug is absorbed, chemical characteristic of the drug, and the route of administrations. And there are different mechanisms of absorption of a drug from the GI tract, which is depending on their chemical properties. These mechanisms, such as first passive diffusion, facilitated diffusion, active transport, endocytosis, and exocytosis, and we will talking about all of these mechanisms and explain them. Firstly, for passive diffusion, which is movement of a drug molecule across membrane from a region of high concentration to a region of low concentration. Actually, in this mechanism, most of drugs are absorbed through this mechanism. Here, there is no carrier involved. That means we don't need any carrier. It could be protein or other substance that work as a carrier to take the drug across the membrane. Here in this mechanism, there is no carrier involvement, and non-saturable. So passive diffusion, for example, of water-soluble drug through an aqueous channel or pool, and passive diffusion of a lipid-soluble drug which is dissolved in a membrane. Carrier actually mediated active transport of a drug, but in this mechanism, as a passive diffusion, there is no carrier involved, non-saturable, and the movement of a drug from high concentration to low concentration of the drug. For facilitated diffusion, entry to the cell through specialized transmembrane carrier protein. Here we need carrier protein. Also, movement occurs from the area of high concentration to the area of low concentration, do not require energy, can be saturated and inhibited by compounds that compete for the carrier. This process is known as facilitated diffusion. It does not require energy and can be saturated and inhibited by compounds compete for the carrier. The carrier could be protein undergo some change, allowing the passage of a drug or endogenous molecule into the interior of cell and moving them from the area of high concentration.